Um, well, good morning, everyone. Yes, I'm here with Darshani. How do you pronounce your
Darshani. It's all right,
Darshani?
yeah.
So Darshani is a nurse from Sri Lanka, and she's been here for 10 months.
10 months,
10
yeah.
months. So she's very new to UK. So we're gonna conduct like a chit chat, like a small interview of her journey to come to UK and working in the UK, how is she adapting to the system and all the journey that she's been through. So here's Darshani. She's gonna introduce herself.
Good morning. I'm Darshani. I'm from Sri Lanka. I take this opportunity to say thank you, my dear sister Rose, to giving me this opportunity to share my experience with you. I had 18 years of experience back home as ICU nurse, and then I just came in UK. Up to now 10 months completed as a UK nurse. So I have completed lots of things before I come here. So I'm happy to share my experience with you.
Right. Thank you very much, Darshani, for this opportunity as well.
Okay, sister.
Giving me a chance to have this chit chat and interview with you regarding your
Sure,
experience in your journey. I have a question. My number one question is, why did you decide to come and work to UK as a nurse?
Yeah, to be honest, according to my Sri Lankan situation, I get this decision to come to UK for the sake of my kids' education. And not only that, I had a dreams. One day I want to become an international nurse. So I think I successfully achieved my dream. It is hostess to the political situation and the condition in the Sri Lanka to take this decision.
Yeah.
It's a hard decision actually. I miss my parents
Of course.
and my both parents. So anyway, I take that decision. Now I'm here as a band 5 nurse.
And congratulations, because it's
Thank
not
you,
easy.
sister.
Yeah. So, what are the qualifications or the requirements? The procedure of applying, because
Yeah.
I know it's different now from
Yeah.
when I came here.
Yeah, basically, sister, we need to completed the language test. All of us know it is IELTS.
Yeah.
Or other than we can complete OET. And then while we are doing these things, we can apply the NMC registration process.
I see.
Yeah, one of my friends, she's Sajivani. Now she's working in the UK hospital. She's the one who given the all information to how we become a UK nurse. And then according to his information, first I applied for the NMC registration.
Yeah.
And completed my English test, and as well as I given my back home registration, nursing council registration and verification done according to their requirement. And then they will send me the CBT booking.
Yep.
I prepared for the CBT, and I faced that exam at Pearson Center in my back home.
Yeah.
Actually, just finished the CBT exam. They will issue my result.
Oh, I see.
Really amazing. Just done the exam. They will issue my result. So after that, I will submitted my result to the NMC. Then I think half of the process over. Then I came here through the agency.
Yeah.
That is JoiN International. And also I take this opportunity to say thank you the J&J International Director, Mr. Jason Joseph. He's the one who supported me to do the things.
Yeah,
And I sent my CV to him with all the documents and certificates. After that, he gave me the interview from the trust. It is my first trust in the UK.
Yeah.
I faced that interview.
How did they conduct the interview? Is it online?
Online interview,
yeah.
Zoom
It's via
interview.
Zoom.
Yeah.
All right.
Before that, they sent us the calculation and the theory part questions. They assess me the knowledge.
Like a test.
Test, yeah. Then I will pass that test as well, and I face the interview. I think within 48 hours, within one day, like they issued my result, I was passed and selected to the
that's
trust.
good. Yeah.
Then I will. They send me the job offer letter.
Yeah.
So then I have to sign and send back. Within 2 weeks, 2 months, like not 2 weeks, 2 months period, I have to complete my medical TB test.
Yeah.
It was conducted the IOM, the UK center, and after completing those documentation process, he started the visa process, and then finally do all the things, and I came here.
Yeah. And then when you came here, did you still have to do, because I heard there's also practical.
Yeah,
apart
after
from
that, the
test.
trust given us the 5 weeks training program. We have to go participate the boot camp.
Yeah.
And then they will prepare for us to the OSCE preparation.
So OSCE, what this OSCE is all about? What does it mean?
OSCE contain all the nursing skills and the theory and practical both. And we can memorize and do the skills again, and they guided us well, very much. Thanks. I take this opportunity as well to thank the boot camp tutors as the opportunity to say thank you everyone.
Yeah, so the boot camp, who teach there? Is it all the educators from the trust?
Yeah, from the trust. Yeah,
I see. And then where did they conduct the OSCE
on
test?
my period, they conducted the class from the trust hospital, Heatherwood hospital.
I see. It's not in university or...
No, then after finish the training and theory part, they will book the OSCE test from the Ulster University. So we have to go to the Ireland to face that test.
Oh my gosh, you had to... You flown to Ireland just to take the OSCE.
UK and the Ireland, 2 journeys in my life.
Yeah, but how many times did you take the OSCE? Is it once? One time?
No, I actually had to face 2 times.
All right.
Yeah, and it's we have to quick preparation for the
second one.
Yeah.
Oh, is it so? On the first take, you said you didn't pass.
Yeah.
Is it just like a particular subject or?
The same
station. Same station.
Yeah, we need to do the 10 station, practicals and the theory.
Yeah.
So there is a time limited within 15 minutes, 8 minutes, 6 minutes, like.
I see.
Yeah, within that time period, so we have to do the things.
Yeah. So it's a time pressured.
When we practice well, we can achieve that target.
Oh, I see. Yeah. So you have
concentration is the best.
So concentration is a must to do, and presence of mind, so that you can finish it within the time limit.
Yeah.
And when you repeated it, did you only repeat the station where you failed?
Yeah, the failed station we need to only that station.
Oh, that's good.
Yeah, that's
you don't have to go through all the
not go through others. Yeah,
those stations you already passed. So.
Yeah.
Oh, that's good. And obviously, finally you passed.
Passed,
That's why you are
yeah.
now a registered nurse
Yeah,
in
after
UK.
after passed the ski,
Yeah.
they will receive. I received my pin within 3 weeks, like.
Wow, that
Yeah.
was so quick.
So quick, yeah.
Yeah.
Then now I'm working
So-
as a band 5 nurse.
Yeah, so within how many months before you started to work as a band 5? Because obviously
I think,
initially when you didn't have the pin yet,
Yeah.
you worked as a
A
healthcare.
healthcare assistant and the band 3 nurse, start band 3 nurse.
Yeah.
After finish the first sitting for the OSCE, we will go to the band 4. Then fully completed the OSCE.
Yeah.
After receive the pin, then go to the band 5
Band
stage.
5.
Yeah.
Yeah, okay. How many months did it take you to finish all this, like OSCE and things, and become registered in MNC?
Yeah, the NMC process, I think it will take very short period. 3 months, 4 months, like. Before that, I have to prepare for the English test. It will take time.
Yeah.
And my back home experience was 18 years of the registered nurse. Actually, I completed my BSc and I successfully completed my master's.
Wow.
And after that, I decided to do the IELTS. And then it will take 1 year, like.
Oh, to apply from Sri Lanka
Sri
to
Lanka to UK.
UK. All right. Okay. Anyway, speaking now that you are band 5,
Yeah,
like a
now I'm
staff,
band
proper staff nurse, registered in the NMC.
Yeah.
Once you have started the job in like in the clinical area, how did you find it?
Basically, they will offer me as the band 5 nurse, the working at the emergency department. Actually, I haven't any experience regarding the emergency department
Oh.
because early I work as a intensive care nurse, but it's not much difference than these two stations. Normally, we have very good stress because the patient came with this various type of disease condition.
Yeah.
So the in here the system was really advanced than the back home. The first initial stages streaming and the things was done by the qualified band 6 7 nurses.
Yeah.
And then they will come to us, as well as the doctors examine the patient, and then they will quickly assess the patient through the consultant levels, and we see the plan, and we have to do the things according to the patient's plan quickly within sometimes we have to done the things within 20 minutes period, but the back home is not such a
It's just not
assessment. And that is, I think that is the difference between developed countries and the underdeveloped countries. The developing countries, the
health system.
system.
Quite different.
This is the systematic
The
way.
practice,
Practice, systematic practice, and very advanced. In here we used very sophisticated and well advanced instrument. But the back home we do the things with the minimum resources. In here we have lots of resources. As example, I can say in here we used one ambu bag for the one patient. Not only that, one tourniquet for the one patient. The back
The
home we
disposable
use.
tourniquet, You have
I'm
to.
sorry to share my experience. Such a minimal resource, we done the things back home. In here is we have so many resources.
Yes.
Yeah.
I can relate to that. Yeah, that's
Yeah.
true. You have to disinfect
Yeah.
and reuse. Here it's all single use for
Single
each
use,
patient.
yeah.
So I kind of like and how about like the system, because it's computerized system here.
Yeah, actually that is the challenging point. As a nurse coming from the developing countries. here everything based on the system and the computer IT.
Yeah.
If we have a good knowledge of computer or IT knowledge, it is easy for us. If you haven't low knowledge of IT, I kindly suggest you to improve your IT knowledge, and it is easy for us to do the things quickly, and everything the computer based. The back home we done everything paper based. That is the difference between the technology.
The technology, that's
And
true.
the nursing part is the same. In here we have lots of resources.
Yeah.
No two words, lots of resources.
So you're more on the challenge for you is the kind of system that we used here.
That is the challenge. But
Because
the time being we can adhere those things.
True.
But it will the initial stage takes time to
adapt.
Yeah.
In every system it's the same anyway, even though for the people who are already here, to change the system, like, because every now and then they change the kind of system that we use in the trust. So you have to learn and familiarize in every step of the computer system.
Actually, I want to mention something. When we are doing our boot camp period, they offer one session for us to the system. The hospital system. They given the chance to participate the 1 day
that's
learning.
Good. Because it's a better
But it is the initial stage is not enough for us. So lots of things we have to keep on our mind.
But I think if you have a new system put in place, you learn as you go along. As you progress, you learn one thing at a time. And everyone does it anyway, because everyone is new to the system. So you're not on your own. You learn from each other.
And also I want to say the working environment, we have a good team.
That's good.
All help each others very well, very nice.
And that's one thing.
That's a good thing.
That's one thing that we need, especially in a like busy area, like very hectic working environment. We should work as a team. We should work together, help each other, help those who are struggling. Because it's so difficult. You can just cry at the end of the shift if you struggle and you can't really,
At the time we have to do lots of things.
So it depends on
the patient's condition.
That's true. It doesn't matter how many patients you have. If they are all the acuity is not too heavy, then you're fine. But if you have one patient which is really, really ill, your time is just with that patient.
Definitely.
That's it, really. But you're coping well, and you're trying to learn. It takes time.
It will take time, definitely.
It will take time. All right. So, this is another question. What are the things that you wished you knew before coming here, so that you could have prepared yourself?
That's a good question for me, actually. Before I come here, earlier I said my friend is here, and she told me these are the things, the list of the things she given me. These are the things you needs to prepare before come here. So I came here end of the winter. I think I came the mid of the January. I think it's the winter period is going on.
I see.
So I prepared hoodie and jerseys, winter jackets, and thermal.
Good.
And the winter boots. Lots of things I prepared from back home. And as well, I want to say thank you, my husband. He is the one who given all the support for me to collect those things, the study purposes, and do the things, everything, and MC registration as well. He is the one who behind me and do all the things.
Wow, very supportive husband. You're lucky. So it's only for the clothings and things
The
like that.
clothing, and as well I prepared some medication. I heard there is a problem with taking the medication, as we wish we cannot go to the pharmacy and request the medication. In the UK it's not, those are the prohibited, so we need to go to the GP, and then this a long process.
Yeah.
So it's certain kind of difficulties in the initial stage. So I will bring the medication that was needful for me as my experience. I bring certain kind of the antibiotics and
For preparation for self-medication.
yeah, self medication.
Yeah, I can relate to that.
And the cold and fever, the paracetamol, cetirizine, like the antihistamine, antipyretic medication, I bring those things.
Yes, because in this country you cannot just buy antibiotics over the counter.
Yeah, over the
Unlike
counter.
in our country, you can just go to
Yeah.
pharmacy and buy. But here, you can buy over the counter such kind of pain relief,
Pain
like
relief, yeah.
ibuprofen, paracetamol, and like antihistamines or anti-allergy. You can just buy it from like pharmacy.
Yeah.
But obviously, there's a limitation for what you can really buy.
So anyway, I
that's
bring
good.
some medication.
Yeah, that's good for you. Have you ever used it though?
Yes,
I
definitely.
see.
Actually, in my hospital accommodation period, my health is very good. Actually, I haven't any disease.
Yeah.
But I'm scared of me myself because I had asthma. I'm a non-asthmatic.
Oh, I see.
No need any medication for me those period.
That's good.
Just change my private accommodation. I had a severe fever. And I think it is change the temperature.
Yeah.
So on that situation, I take some
You
antibiotics.
took some.
Yeah.
Right, yeah. But yeah, upon arrival here, you have to register with GP anyway.
Yeah, then I will register with the GP.
Yeah, yeah. GP is general practitioner, by
General
the way.
practitioner,
Yeah, it's just like a doctor that you would have contact with in the community.
Yeah.
Yeah.
But
That's
it will
good.
take time to get appointment actually.
Yeah,
To be honest,
it does.
yeah.
Even the phone call.
Phone call.
Yeah, like to
Nearly
get
half
them
an
to-
hour, like we have to wait in
True.
the queue.
Yeah. So you're lucky because you have a friend who
Guide me.
guided you and who gave you the list of things to prepare before
Prepare,
coming
yeah.
here. So it's an advantage for you,
Yeah.
isn't it? That's good. Anyway, so now that you are a Band 5 nurse, what are the advice? What advice can you give to our fellow nurses who are aspiring to come and work in the UK?
Yeah, that's a very good question. As a nurse, I am really proud of myself, and I know others are the same. So, my advice is, as much as you can develop your English knowledge or OET, and then try to come here or any other developed countries. Initial stage, you have to go through with the English test and the CBT. It is very easy for you, I know. Normally we do all the things depend on the English. Basically it is depend on the English language. The medical things we studied in the English, and that is the only thing. The CBT is very easy. It's all questions depend on the nursing, and the comparing of the salary also the very good high demand. And try to come to UK or any other developed countries and become an international nurse. Actually it is a very good thing for your life as well as your family.
That's good. So, how about the expectations? Did you have any expectation before coming here?
No, actually I haven't any expectation, and my only expectation is come to UK and
And work.
become a nurse, become a
I
UK
see.
nurse.
All right.
Then after that, actually go through with the exam and the preceptorship program. And now I had a idea, and there is lots of learning opportunities for us that was offered through the trust.
Yeah.
They will show us the way you can go ahead.
Yes.
So now in the first stage, I haven't any expectation. This will be the end point of my life, and this is the specialty I was achieved. No, now I had the idea. We can go so many paths. That was given by the trust.
Trust, yeah. So
yeah.
I know what you meant. It's you cannot. I mean, if you decide to work somewhere else or follow the other path of your career, you can do so.
Yeah.
And the trust will help you.
Yes, definitely.
There's so many
Specialties.
pathways and specialities that you can develop into, which is a good thing for nurses.
Yeah, definitely. In here, I just completed 10 months actually.
Yeah.
But the back home, I spent 18 years. I only have one stage at the back home increment.
Yeah.
In that it is having promotion grade 1, 2, 3 like. In here, within 10 months, they will try to offer these are the specialties, go ahead.
Yes.
They push us. That is the
true.
very good thing as a nurse. That's why I try to come here and develop your career. For the specialties.
True.
Any specialties as you wish, you can go ahead.
Yeah. They will support you with your studies and courses.
Definitely they will support.
Yeah, that's really, really good.
That is the only thing we have interest and the dedication.
Yeah.
If we can sacrifice our life and the dedication, that is the only thing we can go up.
True. That is really true. Very well said. That's good, Darshani.
Well done.
Yes, and congratulations.
Thank you.
For for having a life and work here, for being a fully registered nurse in UK.